I'm 63, and I asked my doctor for these 5 blood tests, and what we found was absolutely terrifying. And I'm going to tell you exactly which tests to ask for, what your doctor probably isn't checking, and the numbers you need to know by heart because they might save your life. My name is Diana Ashton. I'm 63 years old. I spent 28 years as a principal in the Austin School District. I'm a certified health coach through the Institute for Integrative Nutrition, and I'm a registered yoga teacher. But none of that would have mattered if I hadn't decided 3 years ago to push my doctor harder about my health because I was feeling something was wrong and the standard annual physical wasn't catching it. I remember sitting in his office after my blood work came back. He said everything looked normal, everything was fine. But I knew something wasn't fine. I was exhausted in a way that caffeine couldn't fix. I was gaining weight around my middle, even though I hadn't changed my eating habits. My joints ached, and I kept having these moments where my heart would race for no reason. My doctor said, that's just menopause. That's just aging. That's just stress. Well, I wasn't accepting that answer anymore. So I did something that changed everything. I asked him to run 5 specific blood tests that aren't on the standard panel. Tests that most doctors don't order unless you specifically ask. And when those results came back, we found things that were genuinely dangerous. Numbers that explained everything I was feeling. Numbers that would have gotten worse without intervention. And today I'm going to teach you exactly what those 5 tests are, because I believe every single woman over 60 should know about them. Let me give you the 5 tests right now. First, homocysteine. Second, high sensitivity C-reactive protein, or hsCRP. Third, hemoglobin A1C. Fourth, vitamin D, 25-hydroxy. And fifth, a full thyroid panel that includes TSH, free T3, free T4, and TPO antibodies. Write those down. Ask your doctor for those by name. Don't accept a substitute. Don't accept your doctor saying they're not necessary. These 5 tests caught what was silently happening in my body, and they might catch something critical in yours. When my homocysteine came back, it was 14.2. My doctor glanced at it and said it was normal because it was under 15. But here's what he didn't tell me. The normal range that most labs use is 5 to 15 micromoles per liter. But the optimal range for cardiovascular health is actually 6 to 8. And at 14.2, I was in the high end of acceptable, but the low end of disaster. Do you hear that? The lab said normal. The actual science said I was at significantly increased risk for heart attack and stroke. Homocysteine is an amino acid that damages blood vessel walls. It's an independent risk factor for cardiovascular disease, meaning it matters even if your cholesterol is perfect, even if your blood pressure is great. A study published in the New England Journal of Medicine in 2002 found that elevated homocysteine was associated with a 60% increased risk of heart attack in women. But most doctors don't talk about it. They don't test for it. They don't know what the optimal numbers should be. I was walking around thinking I was healthy when my arteries were slowly being damaged. The second test came back even scarier. My high sensitivity C-reactive protein was 4.8. This is an inflammatory marker. The standard CRP test is useless for this purpose. It only shows up when you have acute inflammation like an infection. But the hsCRP, the high sensitivity version, detects chronic low-grade inflammation throughout your entire body. And that's where the real danger lives for women my age. The American Heart Association says that women with an hsCRP above 3 are at increased risk for heart disease, stroke, and metabolic syndrome. Mine was nearly 2 points above that. I was inflamed. My entire system was silently inflamed. And inflammation is the root cause of almost every chronic disease that kills women over 60. Cardiovascular disease, type 2 diabetes, Alzheimer's disease, cancer, arthritis, all of it starts with inflammation. And mine was elevated because I had no idea what was feeding it. Then we got to the hemoglobin A1C. Mine was 5.9%. Now, most people think of A1C only in the context of diabetes diagnosis. An A1C above 6.5% means diabetes. An A1C between 5.7 and 6.4 means prediabetes. Below 5.7 means normal. I was at 5.9. So officially, I was pre-diabetic. But here's what most doctors don't tell you. By the time your A1C reaches 5.7, your pancreas is already exhausted. You've already had years of blood sugar dysregulation. You've already started gaining weight in your middle. You've already started damaging your organs. The optimal A1C for someone my age with no diabetes is actually under 5.4%. A1C measures your average blood sugar over the previous 3 months, so it's not about one meal or one day. It's about what your metabolic health actually looks like. Mine had been telling me for months that I was heading toward insulin resistance and type 2 diabetes, and nobody caught it because they were using the wrong reference range. The vitamin D test is one that more doctors are actually ordering now, but they often get the interpretation wrong. My vitamin D, measured as 25-hydroxy, came back at 32 nanograms per milliliter. Most doctors say that's fine because the official minimum is 20. But the optimal range for bone health, immune function, and disease prevention in women over 60 is 40 to 60. I was deficient. Not according to the old standard, but according to actual scientific evidence about what you need to function optimally. Low vitamin D is associated with increased breast cancer risk, increased colon cancer risk, increased autoimmune disease, and increased fracture risk. It's also strongly associated with depression, which affects so many women my age. I was depressed. I didn't know it was depression at the time. I thought I was just tired. Turns out half of that was my vitamin D being at 32 instead of 50. And then the thyroid panel. This is where things got really interesting because my TSH was technically normal at 2.1, which is in the standard range of 0.4 to 4. But my free T3 was low at 2.8, with an optimal range being 3.5 to 4.2. My free T4 was also on the low side at 0.9, with an optimal range of 1.0 to 1.8. And my TPO antibodies were mildly elevated at 18, which suggested early autoimmune thyroid disease. My doctor had only tested my TSH. He said my thyroid was fine. But the truth was more complex. My thyroid was slowly failing. My body was mounting an immune response against my thyroid tissue. And by testing only TSH, he missed the whole picture. When women are in their 60s, thyroid disorders affect 1 in 4 of us. But if your doctor only tests TSH, they'll miss 30% of the thyroid problems happening in your body. That's not my opinion. That's what the endocrinology literature shows. Full thyroid panels cost maybe $30 more than TSH alone. They take 5 minutes more to order, but they catch real disease. My doctor didn't want to order it. I had to insist. So that was my moment of truth. These 5 tests showed me that I wasn't healthy. I wasn't aging normally. I wasn't just experiencing the natural decline of getting older. I was experiencing a cluster of metabolic and immune problems that would have progressed into serious disease if we hadn't caught them. Let me walk you through what happened next because this is the part that actually matters. For the homocysteine, I started taking a specific combination of B vitamins. B6 as pyridoxal 5-phosphate, B12 as methylcobalamin, and folate as methylfolate, not the synthetic folic acid. That's important. You want the methylated forms because your body might not convert the synthetic versions properly. I took B6 at 50 milligrams daily, B12 at 1,000 micrograms daily, and methylfolate at 800 micrograms daily. Within 8 weeks, my homocysteine dropped to 9.1. Within 6 months, it was 7.8. That's optimal. That's cardiovascular protection. For the inflammation, I did 3 things simultaneously. First, I eliminated the foods that were driving it. For me, that was refined carbohydrates and seed oils. I didn't cut all carbs, but I shifted to complex carbohydrates with fiber. I cooked with olive oil and avocado oil instead of vegetable oil. Second, I added omega-3 supplementation. I take 3 grams of high-quality fish oil daily, which is a dose supported by the American Heart Association for inflammation reduction. Third, I started practicing yoga more seriously. Not gentle stretching yoga, but actual vinyasa flow that elevated my heart rate. The anti-inflammatory effect of regular exercise is profound. When I rechecked my HSCRP 6 months later, it was 1.2. I went from inflamed to anti-inflamed, from diseased to healthy. For the A1C, I cut refined carbohydrates more aggressively. Not no carbs, but dramatic carb reduction. I also started intermittent fasting, which I approach carefully at my age. I do a 14-hour fast, which means I stop eating at 7 p.m. and don't eat again until 9 a.m. That gives my body time to process glucose and clear insulin from my bloodstream. I added 150 minutes of moderate exercise weekly, spread throughout the week, and I added inositol supplementation, which has strong research showing it improves insulin sensitivity. Myo-inositol, 2 to 4 grams daily. My A1C dropped to 5.3 within 3 months. For the vitamin D, I supplemented at 4,000 international units daily, which is above the standard recommendation of 600 to 800, but it's what the research shows women my age actually need. I got my vitamin D retested after 12 weeks, and it was at 52. My energy came back, my mood lifted. Turns out I wasn't depressed, I was deficient. For the thyroid, my doctor wanted to wait and watch. I didn't want to wait. TPO antibodies don't improve on their own, they progress. So I started selenium supplementation at 200 micrograms daily, which supports thyroid peroxidase function. I started consuming seaweed or took kelp supplements to ensure adequate iodine. And I eliminated goitrogens, which are compounds in foods like cruciferous vegetables that interfere with thyroid function when eaten in excess. I didn't cut broccoli entirely, but I stopped eating huge raw salads with kale every single day. When I retested 6 months later, my TPO antibodies had normalized at 8. My free T3 and free T4 had both improved. My TSH was still normal, but now it was 1.8 instead of 2.1, which is actually more optimal. I never developed clinical hypothyroidism. I caught it early enough to prevent it. But here's the thing that really matters and that I want you to understand. These 5 tests didn't just catch disease. They revealed a pattern. They showed that my body had shifted into a metabolic state where insulin resistance, inflammation, and micronutrient deficiency were driving everything. My fatigue came from vitamin D deficiency and thyroid dysfunction. My weight gain came from insulin resistance and inflammation. My joint pain came from inflammation and micronutrient deficiency. One set of blood work revealed an interconnected system of problems that no single test would have shown. And that's why your doctor has to order all 5. Don't let your doctor cherry pick. Don't accept partial information. Homocysteine without A1C doesn't make sense. HSCRP without vitamin D doesn't make sense. Full thyroid panels without understanding your inflammatory status doesn't make sense. These tests cluster, they talk to each other. They reveal the actual state of your aging body. Let me give you one more critical piece of information about optimal ranges. The reference ranges that most labs use are based on the average healthy population. But average is not optimal. Average for women my age includes women with undiagnosed disease, women with metabolic syndrome, women with early cancer or dementia. You don't want to be average. You want to be optimal. And the optimal ranges are: homocysteine should be 6 to 8 micromoles per liter. Anything above 10 and you're at increased cardiovascular risk. HSCRP should be below 1, ideally below 0.5. Hemoglobin A1C should be below 5.4. Vitamin D should be 40 to 60 nanograms per milliliter, and I'd argue it should be at least 50. TSH should be between 0.5 and 2.5, not the old 0.4 to 4. Free T3 should be above 3.5. Free T4 should be above 1.0. TPO antibodies should be below 10. These are the numbers to know. These are the ranges to demand. I want to be absolutely clear about something because this matters. Getting these tests once is not enough. You need to retest. Homocysteine and inflammation are dynamic. They change with diet and supplementation. Your vitamin D fluctuates seasonally. Your thyroid can worsen over time. I retest every 6 months. Every single one of these 5 tests. It's roughly $200 out of pocket without insurance, and I think it's the best money I spend on my health. You need baseline numbers and you need to see the trajectory. A single number is a snapshot. A series of numbers over time is a story, and your story might be different from mine. One more warning before I close. Some of these recommendations I've shared work with each other beautifully, but some supplements interact with medications. If you're on thyroid medication, vitamin D, iron, and calcium can interfere with absorption. If you're on blood thinners, omega-3 can increase bleeding risk. If you're on diabetes medication, the carbohydrate reduction I did could cause dangerously low blood sugar. You cannot hear me say you need these 5 tests and then go implement everything I did without talking to your doctor. What you can do is take these 5 tests to your doctor. Show them the optimal ranges I've given you. Ask them why your numbers are what they are. Ask them what they recommend. And if your doctor refuses to discuss optimal ranges and only wants to use standard ranges, you need to find a new doctor. This is your health. This is your life. You have to advocate for better care. Here's what I want you to do right now. You're going to write down these 5 tests. Homocysteine, high sensitivity C-reactive protein, hemoglobin A1C, vitamin D 25-hydroxy, full thyroid panel with TSH, free T3, free T4, and TPO antibodies. Call your doctor's office on Monday. Ask to schedule an appointment or a phone consultation. Bring a list of these 5 tests. Be polite but firm. Say that you want to optimize your health, not just manage disease, and that you'd like to run these 5 specific tests. If your doctor pushes back, ask why. What is their clinical concern? More often than not, they'll order them just because you ask directly. Most doctors don't test because patients don't ask. That's the real barrier. And if you implement these tests and you find out what I found out, that your body is silently malfunctioning while your doctor is telling you you're fine, don't panic. This is actually good news because now you know. Now you can fix it. I'm not the exception. I'm not unusually sick. I'm just a woman my age who pushed for better information about her body. I'm just someone who decided that normal wasn't good enough, and you can do exactly what I did. In my next video, I'm going to talk about medication combinations that you might be taking right now that are actually poisoning your system. Combinations that your doctor prescribed without realizing that together they're creating metabolic catastrophe. I found out I was taking a combination that was directly worsening my insulin resistance and my inflammation. And that video is going to be even more important than this one because it's about what's actively happening to your body right now. So make sure you're subscribed and you have notifications on because that video is coming next week. I'll see you then.